Hello and welcome to Ask Your Academic. Today's session will cover the MSc Advanced Nursing Practice and Advanced Practice in Healthcare, and we're joined by our programme lead to answer any questions that you have about the programme. We are recording this session, so please don't panic. If you miss anything, we will share the recording afterwards. So Claire, would you like to introduce yourself and give us an overview of the programmes, please?
Sure, yeah. So I'm Claire McFeely and I'm the Programme Director for the Masters of Advanced Nursing Science and Advanced Practice in Healthcare. They are both situated within the Nursing and Healthcare School here at the University of Glasgow. Both programmes are very similar and they have a lot of courses in common, but I suppose the kind of main difference would be that students can join our Advanced Practice in Healthcare either full-time or part-time, and it's open to a range of health professionals or people with a related degree. And then we have the Masters in Advanced Nursing Science, which is specifically for graduate nurses and which is a full-time programme. Both programmes run on campus and we do have some kind of blended learning. We've got our resources and things online. And probably in common with a lot of the other Masters programmes, students get 120 credits through taught courses, and that's usually 6 courses worth 20 credits each. And then if they achieve the grade point average that we require, then they can progress to do the independent project. And it's on completion of that they would complete their Masters.
Perfect. And we're always asked about the Masters project. It's such a big part of an MSc. Can you tell us about the process for that? So how do students select a topic, a supervisor, things like that?
Yeah, so the independent project is this substantial piece of work, and really what we're hoping is that our taught courses prepare the students so they come with all of the skills by this time and understanding that they need to do the project. In our programmes at the moment, the independent project is a desk-based project, so it's a systematised review of the literature. And what we really encourage students to do is to find a topic that's of interest to them and that's of relevance to their practice. Um, so I'm sure we'll talk about this in a bit, but students from our course can go on to a whole range of different careers or different steps. But for students who may be considering about further study and maybe thinking about going on to do doctoral research, then we can encourage them to think about something that's linked to that, because it's a real opportunity to spot the gap and to learn more about the topic. For students who are returning to practice, then there might be something in their practice that has been an issue for them for some time. So, like for an example, I worked with a neonatal nurse, and in her unit they didn't use the soothers, or dummies as we call them in Scotland, and she felt that there was a real kind of gap in the literature and the knowledge and practice around about this. So she was able to fortunately prove her point by the end of it, and then take that back to practice with her. Also, some of our students come from an education background and they might have a particular question round about styles of teaching, methods of teaching that they can do as well. Then we try and match people with a supervisor who has a bit of knowledge particular to their area. In nursing and healthcare, we're quite a small team, but we have quite a wide range of experience. So usually, yeah, we can find somebody who's at least got particular interest, if not direct experience of what the students want.
That's really good, isn't it? Especially if you're going back to like your home country, you can really use your project to sort of hone your interests and skills that you'd like to work on.
Absolutely. So it's good if it's meaningful to the student themselves and relevant to what they're doing, then it's valuable for them, and they come away with a thing.
Yeah. And it's also a bit of a sort of something to put in your CV as well, isn't it, for future jobs?
We're also sometimes our students will publish as well, which is really great for their CVs. They'll publish with their supervisors afterwards.
Oh, amazing. There's some optional courses for the programmes. How soon do students need to choose them? Is that quite early on, or do they get a bit of time?
Yeah, it is quite early on. So we ask them to choose that within their first few weeks of joining the course, so within the first few weeks of teaching. And hopefully that gives them time to find out a bit more about the courses. The courses that we have at the moment are quite different. So students tend to find it quite easy to decide between them. They tend to be drawn to one or the other. So for example, we have a course on acute and critical care. So students who are thinking about returning to practice or have a particular experience in that area will often go for that. We have a course on global health challenges, and so that's got a bit more of a focus on kind of patterns of health, illness, determinants, climate change, and primary care. And so a lot of students are kind of drawn to that a bit more. And we're also hoping to introduce a third optional course. So you would only get to choose one of the 3, but it's about supporting self-management patients. But yeah, so we'd ideally get them to make that decision within the first few weeks. I'm sure you know that there's a practical consideration in this as well, which is that we have to find good accommodation for all of our classes. And so we actually need to know how many students are on each one to make sure it's feasible to run, that they'll get a good learning experience, and that we can accommodate everybody who needs to be in the room.
Yeah, the good old timetabling
I
headache.
know. I'm glad I don't have to do that.
I know. You mentioned there about different things, but is there any patient contact within the courses?
So it's an entirely theory course, so there's no clinical practice. What we try to do is reflect patient voices and patient experiences, and we do that through different resources that we have. And obviously, students on our course have usually got some experience as well, so they can usually bring their experiences to illustrate that. But there's no clinical component to the course.
Perfect. And I know there's no such thing as a typical week as a master's student, but can you tell us a wee bit about what a week might look like? Because it's not Monday to Friday, 9 to 5 typically. There is some class time, but then there's a lot of self-learning involved, isn't there?
There is, and I think that's one of the biggest challenges for students coming onto the programme. So usually, frequently, students will have just 1 or 2 half days in the classroom on campus. And in that time, we try and use that time to do some of the active learning. So we can do a bit of group work. We might use a bit of presentation, but often there's activities that are related to that. But as the course progresses, we also expect students to prepare for those sessions. So we'll give them specific directed tasks to do before they come so that they can bring it and use that information. And then there's follow-up afterwards. And then we would have things like recommended reading. And if students are starting to think about their assignments, they would do a wee bit more research around about that. So at most, it would be 2 half days in a week that they would be on campus.
Perfect. And I suppose it's worth saying, like, there is academic office hours and things like that, that if you do need additional sort of help and things, that's all there, isn't it?
Yeah, absolutely. So we, again, are quite fortunate. We have a relatively small group of students. So hopefully what that means is that the lecturers can make a good contact and be approachable with those students. So for example, every week I have drop-in sessions that students can attend, or they can book a one-to-one appointment with me. We're available by email, but yeah, so we try and keep it really flexible. So there's kind of our official teaching hours, and then there's our kind of available hours around about that. Yeah, we wouldn't want anybody to feel that they were cast adrift in between the sessions.
No, and there is lots of student support services available at the university as well, isn't there? I know
Of
there's
course.
things like academic writing and things like that for students if they need it or want to brush up on any skills.
Absolutely. And I sat in on some of the in-sessional English classes recently just to see how they run. It was really interesting, but a very kind of relaxed approach, like a really positive sort of learning environment to promote language skills. And yeah, our student development service are great. They've got a whole range of stuff that you can either contact them directly or online materials, which are really useful as well.
Yeah. Do you find that the students make their own like little groups as well to like study together and just help each other out?
Yeah, it's interesting to see. So I think a few years ago, you would still see groups of students on campus coming together, and the library was still this kind of central point. We also have a kind of student space here within nursing and healthcare as well. But yeah, there seems to be a lot more students working independently. Sometimes students who are in accommodation nearby will kind of form a natural sort of friendship group as well.
That's nice. And you get all those things now and it's like online, like study together online that people set their phones up. I think that's a really nice idea.
Yeah.
And can you tell us a bit about the different assessments that our students will come across?
Sure, yeah. So it's interesting, talking to students over the last few years, I've realised that for quite a lot of our students, there's a real change from exams and multiple choice questions to looking at how our assessments need to assess critical thinking, and we need to see how they reason things and how they justify things. So we've got a few essays, we've got a few presentations, which I will say students are always very anxious about the presentations, but we have one that's not graded to help them build the skills. And the aim is, like as markers, as assessors, we're looking for the strengths in what they're doing. You know, we're looking to see what they're demonstrating. Our job is not to sit with a big checklist and wait for mistakes. You know, we do our best through our questions and through setting up the environment to get people to give us the best that they can. Again, we try and link our assessments to something that the students might use. So, for example, one of them might be looking at the critical appraisal of an academic paper, for example, a skill that they're going to use throughout their career. When we look at applying research approaches, the assessment is to draft a research proposal. So again, if that's something that the students are already interested in, or if they have a topic in mind, then that's something that they could use afterwards. They could take that away with them. We look at education, and students can plan an education session. That might be for colleagues, for students, or for service users and patients that they're engaged with. And so again, that's a nice practical kind of tool that they can take away as well.
And it's all skills as well that you can use in future jobs as well, rather than doing something that you'll never ever do again.
Absolutely, yeah. So although it's a theory-based program, it's really applied to what they take when they take away. Like we look at leadership, and I always think that's really important. Hopefully, if you're going to go on and be a leader, but also just for understanding the dynamics of whatever place that you work in, it can be quite helpful.
Yeah, and that variety as well is good at brushing up on skills that you maybe things you maybe don't like, but it's good to force yourself into those, isn't it, and challenge yourself.
Yep, absolutely.
And in terms of careers, kind of touched on this earlier, but what kind of careers do students tend to go into after they graduate?
So we have quite a range of kind of follow-on steps, if you like. So we will find that we tend to have a group of students who are interested in becoming educators, and perhaps they're already in some kind of education role, and so they've been sponsored and supported to come to develop that. So they're going to use their masters when they get back in their teaching and applying that directly. We have quite a few students who are keen to go on and do PhD studies. And again, let's say we try and kind of align that as much as we can to prepare them for that PhD process. A lot of our students will return to practice, but the plan would be that they would move to an enhanced role. So perhaps they're thinking about moving into a management role within that. One thing that I think it's helpful for students to understand is we have these advanced nurse practitioner roles in the UK and similar roles globally. Our course doesn't prepare students for that, and it's not an entry into that. Although we have had students who've gone on to do that subsequently, there are usually some really specific advanced nurse practitioner courses that you need to do. So it's not a direct route into that, but hopefully it would still be useful and informative.
Perfect. And then lastly, is there anything students can do before they start their studies in September to really set themselves up for their MSc?
Yeah, so there's a few things. I think one, I would encourage people to read about critical thinking, just to understand the idea about this. So, and we do cover it and we do work our way into it and we introduce it. But as I was saying, for some people, there's a real shift from, memorizing and learning specific things and really embedding that knowledge to thinking about how we think about things and being able to justify our actions. So that's one thing. If there's time, just read a little bit around about that. What you'll find is that they do a lot of it anyway. A lot of this, and it's how we express that and how we demonstrate that we're doing it. And the second thing is about language skills, about being confident and contributing. So much work happens in the classroom, and it's really important that students can take in everything that's going on, but also confidently engage in it. So quite often we've got students who've got great language skills, but just don't have the confidence to kind of use them in the classroom. And also, obviously, we've got the range of Scottish accents, and in particular the Glasgow accents as well. So if you are coming to Glasgow, then spend a bit of time trying to engage with people locally. That would be my top advice.
Yeah, and I think getting here early as well so that you can do all your personal admin, get set up,
Of
and
course.
then when your classes start, that's your full focus. And if you're here early enough, you can then get out and about and like speak to people, can't you? And I would
Absolutely.
always say we do get quite excited when we get excited, we start talking really quite quickly. So tell us, I can't understand you. Slow down. Take a
Yes.
breath.
Absolutely. And I think as a teacher, you get quite interested, quite excited about something, or you think, I'm labouring this point, I'm going to move on a bit. But yes, I always encourage the students just to raise their hand at the back and tell me to slow down.
Yeah. Oh, well, thanks very much, Claire. We've run through all those questions that have been submitted beforehand. So thanks very much for your time today. I know how busy you are. And if you've got any further questions, please don't panic. We've got our programme email addresses on our programme web pages. So if you think of anything, do drop us a note and we'll get back to you. The teams are brilliant at responding to questions. And hopefully we'll see you all come September. So thank you very much. Bye bye.
Lovely, thanks.